Patient-reported outcomes have become a very important way to gain insight into outcomes of disease. What the patient experiences and is able to communicate to the doctor is sometimes at least as important as the data from the lab tests that we order. One of our junior faculty members, Shantanu Kasturi, has recently been awarded a master's degree based on a project that she led studying the role of the PROMIS outcome measure in lupus patients. So PROMIS is a way to gain insight into disease based on the reports of patients. There's a whole range of questions that are posed to patients, and there's a computer aspect to the study where, based on the answers, the computer selects what the next most appropriate question to be posed to the patient is. So Shantanu will be presenting a poster that describes the work of her master's thesis and describes the potential for patient-reported outcomes as important ways to measure outcome in patients with rheumatic disease. Research is so important. It's the way we gain insight into disease mechanisms, gain new ideas for therapeutic targets, and take those ideas to new drug development and new ways of managing patients. It's absolutely essential that clinicians become involved in research studies, whether it's through your ideas, through describing ideas for research studies, and perhaps most importantly, engaging your patients in participating in research. Patients sometimes need to understand the value of research and also how they can contribute, and often are very, very enthusiastic about contributing to research. So I would encourage all clinicians, all rheumatologists, to really think about how they can advance research and work with their patients to participate. There's a clear trend toward identifying patients with rheumatic disease even before they fit all of the classic classification criteria or diagnostic criteria for those diseases. So we're very attuned to thinking about identifying patients with early inflammatory arthritis who might develop into patients with rheumatoid arthritis, looking for those patients with manifestations of lupus that don't fit the full criteria. And so it's very, very important that rheumatologists think about and are alert to the symptoms and complaints that could suggest early disease, because I think we're learning that the earlier a disease is treated, the more likely it is to be successfully treated and even prevent more severe manifestations.